Hi there. So I'm going to go over a bit about how you would take a functional breath. It's not as intuitive as you might think it would be. Usually in medicine, we say that anywhere between 12 to 24 breaths a minute while you're sitting at rest is normal. But functionally, you can probably get away with 4 to 6, and that's really a state where you are more relaxed and your body is using oxygen a little bit more efficiently. I can explain the science and why you might want to go with a functional breath a little bit more in a separate video, but let's keep this video here mostly instructive, okay? So to start with this practice, what you can do is find a comfortable spot to sit down. Make sure your feet are flat on the floor and your legs are at more or less at a 90-degree angle, or with your hips slightly higher than your knees, okay? So feet flat on the ground, don't cross your legs. If you're not used to breathing functionally, what you might be able to do to help yourself a little bit is put one hand on your chest and one hand on your abdomen. And the goal here is really to expand your abdomen three-dimensionally while you breathe. A lot of people, if they haven't really practiced deep breathing before, and they have a little bit more high stress in their lives, you'll see that the shoulders get really tight. And if you really pay attention to the way that you breathe, you might notice that your shoulders are moving up and down as you breathe, and your abdomen is tight, your chest might be tight, or your chest might be breathing all up here. That's kind of the shallow breath that we want to correct with functional breathing, okay? So one hand on the chest, one hand on the abdomen. Your goal is to have it so that your upper hand moves as minimally as possible while your lower hand kind of comes out, all right? So by taking a breath into your abdomen, go. Just getting a sense of that movement there. So getting a sense of moving your abdomen out without moving your chest, okay? And if you're finding this to be a little bit difficult, you can practice by interlocking your hands like this and just bringing your hands up like this. What this does is it locks down your upper rib cage here so that you can't really move this to breathe. It almost forces you to use your abdomen, so you can do this for a little bit and focus on pooching out your abdomen almost in order to get your breath in. So getting that in there. So that's step number one, is getting a little bit more of the sense of that movement of the abdomen. The other thing that you can try is take your hands, put them at the ends of your rib cage right here, and your goal here is to try to create space between your hands. So almost like pushing your hands outward with your rib cage. And for now, just kind of get a sense of that movement, okay? So getting a sense of the movement with the abdomen, getting a sense of movement with the rib cage. Now here's step two. Step two is the timing. What you're gonna do right now is take as deep a breath as you can, and when you feel like you cannot fill your lungs even more, take 3 more sips of air. So do this with me, go. That is your 100%, okay? That's 100% of your functional lung capacity. We're not gonna do that during our functional breathing, okay? So what you wanna aim for is maybe between 30 to 60%. So what your normal breath might be, okay? So kind of pay attention to how you normally breathe. Okay, that might be like 30 to 40 to 50% of your lung capacity compared to that 100%, all right? We're going to emulate that in this functional breath, okay? So breathing no more than that. But what we're gonna do is we're gonna slow it down and move it to our abdomen, okay? A good starting point for people is between 4 to 6 seconds per breath. So what we can do is count 1, 2, 3, 4 while breathing in and into your abdomen, and then 1, 2, 3, 4 out. Okay? So hand on the abdomen, hand on the chest. Counting 1, 2, 3, 4 out. 1, 2, 3, 4. And then eventually moving on to 1, 2, 3, 4, 5, 6 out. 1, 2, 3, 4, 5, 6. And now while you're breathing, kind of envision this this slow filling and then this slow releasing. So what you don't want to do is go. We don't want this sharp kind of, that we don't really want to see this sharp angular breathing. Think about it as like this smooth wave where when you take in your breath and towards the end of taking in the breath, you kind of slow down to a stop before letting it exhale. And as you reach the end of your exhale, slow it down until you reach the point where you inhale. So kind of a smooth wave. And one of the things that may come up is that, oh, well, counting to 6 is too slow. Then my breath becomes too deep. Then I'm taking too much breath. It's more than that 30%, that 40%. What do I do? Well, here's the thing that you can do is slow down your breath. Pretend you are taking in your breath like it's molasses through a straw. So really slowing it down. Okay? So those are the main points of a functional breath. 1, breathing 3-dimensionally, using mostly your abdomen and your rib cage. 2, slowing it down 4 to 6 seconds per breath. And 3, smoothing it out, slowing it down. Okay? And that's your functional breath. Let me know if you have any questions.